3, 2, and 1.
Good evening, everyone. My name is Arturo Valdez, and I am the Los Angeles County Deputy Superintendent. Thank you so much for joining us for tonight's virtual town hall for parents. This meeting is hosted by the Los Angeles County Department of Public Health, the Los Angeles County Office of Education, and the Los Angeles County Department of Mental Health. We have a lot to discuss, as you all know, but to start, I want to introduce the panelists that we have. We have Dr. Barbara Ferrer. She is the Director of the Los Angeles County Department of Public Health. We have Dr. Deborah Duarto. She's the Superintendent of the Los Angeles County Office of Education. We have Dr. Sharon. He is the Director of the Department of Mental Health. And we have Dr. Vivian Etienne. She is the Superintendent of the Glendale Unified School District. First, I want to tell you a little bit about the town hall and how we will move through the evening. To start, our speakers will provide brief remarks on a variety of topics, and then we'll transition to the question and answer. So far, we've received about 300 questions ahead of time. We won't be able to answer all of them, but we're going to do what we can to get through as many as possible. You can also submit questions during the town hall in the chat box, and we'll get to them very shortly. Let's get started. To start, I'd like to introduce Dr. Barbara Ferrer, the Director of the Los Angeles Department of Public Health. Dr. Ferrer.
Thank you so much, Deputy Superintendent Valdez, and good evening to everyone. I'm so pleased that you're able to join us for tonight's parent town hall. I do, as always, want to recognize and thank Superintendent Deborah Duarto and Deputy Superintendent Valdez of the Los Angeles County Office of Education. They've been just our amazing partners for a very long year now around our COVID-19 response. But before that, and I know after this pandemic, we remain really proud of a strong partnership with the education community. I also want to thank Superintendent and Dr. Vivian Etienne from the Glendale Unified School District, and of course, my friend and colleague, Dr. Sharon, the Director of the LA County Department of Mental Health, for their partnership, again, all throughout this year, but especially for allowing us to come together to talk about this important transition as we are able to move more children back onto school campuses, and for their tremendous support and work throughout the course of the pandemic. I want to acknowledge and thank from the bottom of my heart all of the parents across our county for the tremendous support you have provided to your children through this very challenging year. You've had to play so many roles in your children's lives in addition to that of being a parent. You've had to be a co-teacher and a tutor, and often for many children, their playmate as well. As schools have returned to in-person instruction, I know that you're all navigating yet another important transition in the lives of your children. And I understand that you may be wondering why, after nearly a year of distance learning, schools are now allowed to permit the return to in-person instruction if they choose to do so. Given the progress we've made in reducing the transmission of COVID-19 across the county, research solidly indicates that schools can begin returning to in-person instruction with very important safety measures that are required and must be in place to protect students, teachers, and staff from infection. On March 12th, LA County met the threshold to qualify for moving into the red tier within the state's blueprint for a safer economy. And this is the framework that allows reopenings across the state. And it indicates the move for us from a county experiencing widespread transmission to a county experiencing substantial transmission. Our rate of daily new cases has significantly dropped from a high at the beginning of January to over 48 new cases per day per 100,000 residents, to a rate now of 3.7 new cases per day per 100,000 residents. This drop is thanks to all of the great effort made by you, your families, and everybody at our workplaces. Given the lower rates of community transmission of the virus and increasing vaccination rates, moving into what we call the red tier has meant that LA County schools are now able to open for on-site learning for students in grades 7 to 12, in addition to grades TK through 6, which had been permitted to reopen for on-site instruction back in mid-February. And I know some students and families may be very nervous about the school reopenings, and we understand that many of you may feel uncomfortable with having your children return to the campus for in-person learning right now. So I want to note that public health does not require that students return to in-person learning. Each school district or individual schools in some cases will make a decision about offering in-person instruction. And then each family will make a decision about having their children return to campus. Quality distance learning will continue to be an option for those students that remain at home. But for students who do return to the campus, we have been working really hard to ensure that schools have the tools they need to operate with as much safety as possible. This includes requiring every school that's open to adhere to essential public health requirements around masking, infection control, distancing, and also managing cases and outbreaks. To support a safe return to on-site learning, public health staff have worked with school districts and schools every single day to ensure that our public health directives are understood and fully implemented. Our school technical assistance team here at Public Health has over 100 practitioners that they contact every school that's reopening and arrange for site visits where they can advise on safety measures and offer recommendations on how schools can effectively follow all of the protocols. Our public health practitioners also assist in all case and outbreak management at every single school. And schools are required to report to us any cases among individuals in their school community to ensure that there is appropriate follow-up. To date, that school assistance team that I talked about, they visited over 1,500 campuses to assist them put in place the necessary measures to prevent the spread of COVID-19. And they've consulted with hundreds of schools that have reported cases and outbreaks. And just to note, to date, we've been open, schools have been open for a variety of services since September. There have only been a handful of school outbreaks that involved more than 5 people. And in this handful of outbreaks, they've been primarily either among all staff or members of sport teams. In addition, Public Health, the Los Angeles County Office of Education, and the Los Angeles County School Districts are working together to provide essential information about COVID-19 to parents and students through the newly launched Public Health Ambassador Program. The Student Ambassador Program creates a space that meets students' emotional and social needs for community. It builds students' understandings about the tools for preventing the spread of COVID-19, and it provides opportunities for leadership and action by raising community awareness about COVID-19 and key prevention measures. The Parent Ambassador Program, and you can see here how to connect to this program, provides prevention education and community engagement opportunities to parents in partnership with their school districts. These programs are free and all parents are encouraged to participate. The program begins with an online training conducted in English or Spanish by a parent educator or promotora over Zoom, followed by monthly town halls to provide ongoing updates, expert speakers, parent networking, and engagement opportunities. And these also are question and answer sessions for parents. In the Ambassador Program, parents will learn proven safety practices for home and in the broader community. They'll become familiar with the measures that schools are putting in place to keep students and families and staff as safe as possible when they're on campus. And they'll be able to identify strategies to educate and encourage others in our communities to practice proven safety measures. I'm enormously grateful to have Dr. Vivian Ekchian, the superintendent of the Glendale Unified School District, here to tell us about her school district's ambassador program. Dr. Vivian, I'm so glad to turn it over to you.
Thank you very much, Dr. Ferrer. It's been a joy to introduce the Parent Ambassador Program in our Glendale Unified School District. As we know, we are a diverse school district, and we have many of our students living in intergenerational homes. So giving an opportunity to our parents to learn through this ambassador program and allow themselves through the certification to go out there and become influencers and multipliers of the information that needs to be out there to keep our community safe is front and center on everyone's mind as we're reopening schools. Schools, we know, will be safe if the community is safe. And all the lessons that are offered and the best practices are not just for those who participate in the training, but part of their responsibility is also to take that message to the community, whether it is in their apartment building, whether it is in their church community or any other location where the message needs to be traveled. I'm really looking forward to the ongoing networking, because as we launch into immunizations for our community members, that will be the next phase. And as we speak about our bubble and how we can keep safe, whether it is during holidays or any other part of the time, this ambassador program becomes a capable other that is allowing us to learn along the way and to learn from parents to parents and expand the networking that can exist in our community. So I'm very grateful and optimistic that this will take us to the next level of safety in our community. So thank you for allowing me to share.
Hi, I'm going to go ahead and introduce myself. I'm Dr. Deborah Duarto, Superintendent of Schools for Los Angeles County. And in LA County, for those of you parents who didn't know, we have 80 public school districts and more than 350 charter schools that we work with, serving over 2 million children from early childhood education through 12th grade in LA County. And I am really excited to let you know that we have been planning on reopening schools since the day we shut down. It's been quite a year. A lot has happened since schools have closed and we've had to move to distance learning. One of the things we realized is how this pandemic has really put a spotlight on inequities. And we very quickly found out that this pandemic and learning was more difficult for families that didn't have the equipment, the Wi-Fi that they needed, and there was a lot of disruption in every area of education and really in every area of our lives. But the great news is that the situation is progressively improving, just as wonderful Dr. Ferrer has announced to everyone. The rates have significantly decreased and they continue to come down. And LA County, is in the red tier, and we're getting a lot closer to getting to the orange tier. I also want to say that I'm really excited that the partnership that we have, and when I say we, I mean Dr. Ferrer with the Department of Public Health, Dr. John Sharon with the Department of Mental Health, we've been working very closely together throughout this pandemic. And in just 2 weeks, LACO and DPH was able to work with all of our school districts to offer an opportunity for all school employees to get vaccinated. That's pretty amazing in a short period of time. As I said, we're planning on reopening schools for in-person instruction. And by the end of April, 77% of LA County school districts will be reopened for in-person instruction. You know, the other important thing to remember is that schools are not losing sight of the social, emotional toil that has taken place during this pandemic. And we've realized that parents and families and students rely on school to provide additional supports and services. So we are making sure that district staff is cultivating connections with our students and families despite the school closures. And we really plan to focus on healing and social, emotional well-being when everybody comes back to school. You know, we also are going to continue to make sure that we're closing that digital divide, even beyond when students are returning to school, because we know that we're still going to use technology as schools are opening in a hybrid fashion, and also for accelerated learning and supports. So we want to make sure that our teachers, all of our employees, are also listening to our students and families to understand some of the non-academic barriers that can prevent students from being engaged in the classroom. And we know that for some students that have disadvantages, whether it's poverty or health inequities or access to after-school care, our students experiencing homelessness or our foster youth are having more challenges. And we want to make sure that we're keeping a close look and providing the support that our students need. And for parents, I mean, this has been a very difficult year for you. I know it's been hard. So we're going to be providing information about mindfulness, about emotional regulation, so that we can all model and support our students' social and emotional growth. So we are looking at being innovative, making sure that our distance learning is excellent for those days when students are still at home. And really what we want to do is learn from this whole pandemic to really transform our entire educational system, because we know that the system hasn't always worked well for everyone. So we're going to make sure that we're focusing on improving all levels of education, challenging conventional thinking, and really looking for creative solutions to some of these long-standing inequities. We know that out of crisis comes renewal. It's an opportunity to grow, to learn, to improve, and we're really excited to work with all of you to make sure our students and our families get everything that they need. Thank you.
Thank you so much, Dr. Deborah Duarto. I now want to introduce Dr. John Sharon. He's the Director of Mental Health here in LA County. Dr. Sharon.
Thanks very much. Can you hear me?
Yes, loud and clear.
Okay, great. Well, you know, first, real honor to be here. And what a incredible part of our community, the parents of our students. I want to recognize the really, really powerful partnership between these departments, which, as Dr. Ferrer pointed out, is something that is ongoing. I think that the pandemic and other challenges have really allowed us to, and at the same time forced us to up our game as a larger team. And you're a part of that team. Without the parents, without the kids, we won't be able to move forward and achieve all the things that are possible. From a mental health perspective, you know, I'm talking to parents, we're talking to parents, but really we're talking to households, we're talking to the nests where people spend their time. And I will say that when it comes to school, it's not possible for our students to learn, for our teachers to teach without paying attention to mental health. And there clearly have been a number of really significant factors that we've experienced, and we've experienced them here. They've been experienced all over the world in a way that no one was prepared for. And I'd like to talk about a few of them. Isolation and loneliness. Unfortunately, in the context of staying at home and being physically distant, isolation is, you know, a really broadly experienced, and I would say challenging phenomenon. Loss. There's been so much experience of loss, whether it's people, routines, a sense of control, loss of purpose or personal agency, of jobs, of income, and uncertainty about the future. So these things are all significant traumas. And, you know, many of us in the field have been talking about the mental health pandemic, which is something that I believe will be longstanding. We're going to be feeling the impact of, you know, collective trauma for a long time to come. Now, how does that show up? Well, it shows up in many different ways. A lot more anxiety, a lot more depression, a lot of physical symptoms that are hard to explain, but these are all expected. These are all things that we would expect and predict. And what we need to do is to figure out ways going forward to manage them and to deal with them. One of the big opportunities from my perspective in this field is to increase access to care, access to treatment when it's needed. And, you know, one of the silver linings, and I believe there are many, of this pandemic is that the need for mental health and the impact of not feeling mentally well has been experienced at such a broad level that more and more people, communities, elected officials, individuals in power recognize that we have to really focus on and prioritize mental health, whether there's a pandemic or not. One of the key things about dealing with trauma is recognizing that while there's post-traumatic injury, there's also an opportunity for post-traumatic growth. And I like to think about how we, as a collective, empower our communities and not become victims. One of the things that is really critical here is to take the learning of the past year, the silver linings, and not see them as a reaction or a response only to the pandemic, but as things that we've learned and we're going to pay forward for a better normal. In terms of where we go next and the idea of recovery and going back to in-person learning as an example in the schools, this is really a reintegration type paradigm. It's not so much resumption. It's not, oh, we're going to jump right back in. And there are a few key things I'd like to mention in the context of reintegrating. And the first is to connect, stay connected. Isolation, as I had said, is antithetical to good mental health. So reconnect with your school community, do it at your own pace. Identify ways to be more social, but safe. And I will say that we in the Department of Mental Health have an emotional support line that's available at 800-854-7771. You can find out a lot of information and a lot of resources on our website, but we encourage people to reach out to us. We've got trained clinicians, peers, people who are available to talk with anybody about what's going on. And that's an important part of connecting. In addition to connecting, communicating, using words that are positive and healing, where people can feel that they belong and that they're supported. You as parents know your students better than anyone, and you can advocate for what they need. That's what you do, and that's why you're here. We expect that. We expect you to reach out. It's important to share your ideas and your feelings and to listen really actively, especially to kids and when they're going through the changes in their school environment, just like other members of your family. And if your student or your kid is expressing concern about returning, check in frequently, talk it out, and use the information that we have. Knowledge is power, and we have to be well informed in order to talk things out in the most healthy and constructive fashion. And then lastly, self-care. We have to actively practice well-being in ways and in frequencies that suit each of us. And those are really basic things in general. Eating and sleeping and exercising as much as we can in ways that work for us, meditating. And one of the things that I think is really important is to avoid the overwhelming amount of information, much of which is conflicting. So spending too much time online, spending too much time trolling stories, watching TV, in many cases is problematic, and I think is creating a lot of anxiety for a lot of people. So limit the amount of time that you're digesting and processing information. We also at the Department of Mental Health have made a mental health app known as Headspace, available to all LA County residents. In addition, we have a treatment tool, virtual treatment tool called I Prevail, which will be available sometime within the next month, which actually allows people at their own, on their own schedule, anonymously, to do treatment paradigms. Very exciting development and something that we think could be very helpful to individuals, and we are happy to talk about that with people on the phone. This is new territory for us all as a collective. We have to practice patience, tolerance, and flexibility. Those are keys. We have to navigate together. That's the memo that I've gotten from COVID, from the economy, from all of the social unrest. The universal memo to us is to recognize our interdependence and work with each other to navigate for a better future. Thank you.
Thank you, Dr. Sharon. Really do appreciate that. I wanted to see if I can go back to Dr. Ferrer because she was unmuted at the end of her opening remarks, and also perhaps maybe she can introduce her team member that is with her here today. Dr. Ferrer.
Yes, thank you. Can you hear me now?
Yes, yes.
Okay, perfect. And I'm so sorry about that. Yeah, I do want to note, and I apologize for not introducing you, Dr. Duarto, as we moved on. But I do want to note that I am here with Dr. Gilchick. He is our Chief of Child and Adolescent Health, and he'll be helping us answer your questions tonight during the question and answer period of the of our town hall. So I'm really glad he's with us. Some of you already have known him from past meetings that we've had, but he has been providing a lot of support to our school districts and our independent schools over this long year. And he's the most familiar person with reopening protocols. So it's always good to have Dr. Gilchick with us.
Thank you so much, Dr. Ferrer. And I think it's just great that for this parent town hall, we have the top person related to health here, and Dr. Ferrer. In the county and education, we have the top person, Dr. Eduardo, and of course for mental health, we have Dr. Sharon, who is our top person. And we appreciate all of you and what you've been doing, and we value your time, and I know that parents are getting a lot out of this. So let's jump right into the questions, because we have several questions that are out there, and we're going to get to as many as possible. Remember, you can also submit your questions in the chat box, and we encourage you to do that. So let me start with the first question. And before we do that, I also want to thank Dr. Etienne, who is one of our premier superintendents in the county, for her help with the ambassador program. We encourage you to look into that. You had the link earlier today. So Dr. Ferrer, the question is, with the distancing guidelines now that shifted to 3 feet versus 6 feet, the question is my child an automatic close contact if they sit near a positive case? Doesn't this put them more at risk in the classroom?
You know, it's such a great question, and fortunately, there's been a lot of research that the CDC pulled together to answer the question about what kind of distance do you really need to keep between children in the classroom. As we all know, children have been less likely to get infected, although they do get infected, than adults, and less likely, particularly young children, to pass along infection to others. The 3 feet works in a classroom setting because everybody is essentially masked all of the time. If you were to look at a situation where people were in fact not wearing their masks in that classroom setting, that wouldn't be as safe as it ought to be. And if you were to look at a situation where you also didn't have good infection control in a classroom, that situation wouldn't be safe. But if you put everything together, required masking, the distancing of 3 feet, not sharing personal objects, obviously not sharing any food or drink, and actually when students are eating and drinking, they should actually, because they're taking off their mask, go back to being 6 feet apart. They're able to wash their hands frequently. You put a layer of protection in that classroom that actually all of the research has shown can be very, very effective in reducing transmission. But I do think you're right to raise the question of what does this mean for close contacts? Because the rule for close contacts has not changed. And the rule is that if you've been a close contact, and that is defined as 6 feet or less from a person who is positive for COVID-19 over a 15-minute period in 24 hours, so over a whole day, then you are a close contact. So whether you were sitting 6 feet apart or 3 feet apart, you will be, in all likelihood, determined to be a close contact to another person in the classroom. And I want to note, many times during the course of a day, children, particularly younger children, can in fact come in contact with each other as they're doing additional activities. So for most of you who have either had your children at school already or had children in daycare, you know that when there's an exposure in a classroom setting, one of the reasons why we ask for stable groups, there may be a significant number of children in that classroom that are going to be asked to go home and quarantine for the 10-day quarantine period. But there really isn't a difference between that 3-foot barrier and the 6-foot barrier in terms of whether you would be considered a close contact. Again, you know, the further away you are from people, the more you wear your mask, the less likely there is going to be transmission. And that's just the way that we have to think about this issue over time. But in a classroom situation where students are sitting and receiving their instruction, the CDC has done extensive research and determined that that 3-foot distance provides a lot of safety.
Thank you, Dr. Ferrer. Appreciate that. And there's some good tools that schools have in their armory as social distancing, the washing the hands, and I'm assuming these are the things that are talked about in the ambassador program, which was referenced by Dr. Etienne earlier. So that's great to hear. Our next question is for Dr. Gilchek, and Dr. Gilchek, the question is, the California Department of Public Health has added marching band, colored guard, drumline to a list of low contact youth recreational activities. Will the Los Angeles County Department of Public Health do the same and give our students a pathway to playing safely again, given the amount of PPE that is now available to musicians to be able to play safely outdoors?
Yes, thanks, Mr. Valdez. The short answer is yes. We are working on that guide. Actually, that guidance is under development right now. Where a number of us are working on that document. As you know, we generally do. We align as closely as we can with state guidances, you know, to the extent possible. Now that they have issued that change, we are also working on that, and we will do our best to issue protocols and recommendations that will allow students to take part in those sort of performing arts programs, whether it's musical, instrumentation, singing, dramatic arts, and look for that shortly. So the answer is yes.
Thank you, Dr. Gilchek. I know a lot of parents and students are going to be really happy about that. Our next question goes to Dr. Sharon. Dr. Sharon, what are some of the signs to look for if a child is struggling with a mental health issue during this time?
A great question. And you know, the way that we see mental health challenges expressed in children is different. In some ways, it's quite similar. Obviously, you know, if the kid seems to be down, fearful, you know, or other signs of depression like not sleeping well, not eating well, those can be concerning. I will say that in kids in general, periods of anxiety and periods of feeling depressed tend to be shorter lived than in adults. The other thing is physical complaints, stomach aches, headaches, vague complaints of not feeling well. Of course, those could be indications of a physical illness or even a virus, but they're also potential indicators that there's an emotional situation that is going on. And then obviously just behavioral changes, personality changes, more activity than usual, less activity than usual. These are things that parents and certainly teachers who are familiar, and also friends can pick up on. Sometimes they're subtle, sometimes they're not subtle, but they're all red flags. And I would say that the idea is not to, on constantly monitoring, but just to be aware of the fact that if something feels different, that it's worth exploring. And the easiest way to explore it is just to talk it out. And if in talking it out, there's still a lot of question about what might be going on, that's when you reach out to a professional. Reach out to us. We can't help you. We'll find someone that can help you. We can help triage a child, a family, to get the kind of assessment and treatment that would be helpful to them.
Thank you so much, Dr. Sharon. Our next question goes to Dr. Ferrer and/or Dr. Duarto. Are parents allowed to know how many staff members or teachers or principals are vaccinated in the school site?
I don't want to speak for what all the schools are going to be able to do, particularly for the independent schools. I do want to say that your immunization status is protected information, and you can't really access that information as an outside entity unless there was a requirement by law that you have to, in fact, produce that information. And right now, there is no such requirement for showing proof of immunization, certainly in our public schools. That being said, in private schools, there may be a different set of expectations, but in general, we like to protect the privacy of people with all of their health information, and this would be another situation. I certainly think it would be fine to do a voluntary survey, where you asked teachers and staff to provide, if they're willing to, information about their vaccination status, and you may be able to use that to get a sense about what the vaccination rates are. But there is no legal requirement right now, and we're not anticipating that will happen anytime in the near future. I think the most important thing for everyone to know is that, hundreds of thousands, frankly, of teachers and staff at this point have been vaccinated. In LA County alone, we're well over 140,000 teachers and staff vaccinated at this point with at least one dose, and many of those people are actually completing their second doses in these upcoming weeks. So we've had just enormous success, I think, in having teachers and staff come in and get vaccinated. And as with any new treatment and new medical vaccinations, I would consider a new treatment. Some people may be a little bit hesitant and they may be waiting, and that's perfectly fine. They can get vaccinated when they feel ready to get vaccinated. And as you all know, starting on April 15th, everybody in LA County that's 16 and older will be eligible to get vaccinated. The good thing about vaccines is the more people that get vaccinated, the more protection we all have. So we give each other protection when we're getting vaccinated, even if other people around us don't all necessarily get vaccinated. And you hear everyone talk all the time about herd immunity, which really means at a certain point you have enough people vaccinated, even if it's not everyone. We often talk about 70, 75, 80% of people getting vaccinated will really offer us a lot of protection against both reducing transmission and, most importantly, not having people get very sick and dying from COVID-19. So I think, it's helpful to know that all teachers and staff at this point, I think Dr. Duarto can talk to this, have been offered vaccine, that we've had a very high, what I consider uptake, a lot of people coming forward and saying they want to get vaccinated. And with some, voluntary surveys, we may be able to get some information that we can share publicly. But the most important thing is that we're offering vaccine. There's ample vaccine for teachers and staff. We've set aside a lot of vaccine and in fact, made it a priority to reach teachers and staff in a timely way. I don't know, Dr. Duarto, if you wanted to add.
Totally agree with what Dr. Ferrer just said. We've offered the vaccine to all of our school employees, and many districts have returned vaccines saying that to give it to another site that needs it because their staff have been fully vaccinated. So I think the majority of our educators were really excited about getting vaccinated, and schools are eager to make sure we're doing everything as safe as possible. So we cannot, as Dr. Ferrer said, there is that confidentiality where we cannot provide individual information about who has or has not been vaccinated, but I can assure you that the majority of our school employees have been vaccinated.
Thank you so much. Here's another great question that everybody's really talking about, and it goes like this. My family and I are traveling out of state for spring break at the beginning of April. Will I still be required to quarantine for 10 days following our return, or has that order, Dr. Ferrer, been updated?
Yes, I'm just going to start with yes, you will need to quarantine for 10 days. And I'm also going to plead with everyone. We still have a travel advisory in effect across the entire state. Nobody is supposed to be traveling more than 120 miles from their home unless it's essential. So recreational travel in general is not essential. I know it's been long and hard for this past year, and many of us are feeling a sense of relief as case numbers go down. But travel is still a relatively unsafe activity to engage in. And for everybody who's paying attention to what's going on elsewhere, there are huge outbreaks in most of the countries in Europe. The East Coast is seeing over 10% increases in their cases. Michigan went from 1,500 cases a week ago to 3,000 cases in just 7 days. And you've all seen the, really disaster of Florida. That's why we still have a travel advisory. And that's why if you decide you do need to travel, please come back and self-quarantine. If you've had exposures during your travel, you've been in crowded situations, you've been hanging out with people indoors without your mask, then not only should you be quarantining for 10 days, but you should also get tested. The last thing we need here in LA County is for us to go through what happened over the winter break when everyone started traveling, and we saw, just a devastating consequence to travel over holidays. So I'm going to just ask everybody, I really think I can say with a lot of confidence, this will be the last set of holidays where we're going to ask you to really not gather still, to adhere to all of our rules, to not do that travel far from where you live. Stay here. We're lucky, we're blessed. We live in a beautiful county, got lots of beaches, lots of trails. The weather is really good here. I know there's more that you can explore with your family during spring break, but I'm going to ask you, please not travel. Hold off another few months. Things will get a lot better. A lot more people will be vaccinated. There'll be a lot more safety if you just wait until the summer. So thanks for that question.
Thank you, Dr. Ferrer. And I can see that staying home and being close to home is going to put us in an even better situation after spring break. So thank you for that. Dr. Sharon, the question is, mental health wasn't very important to my family when growing up. And talking about these things is now very normal, especially for my kids. But this is all new to me, and I feel like I don't know what to say to them.
Well, first off, I want to acknowledge what you're saying, which to me is very encouraging. That stigma around feeling badly or having some type of mental health issues is a problem. And what we have to recognize, and I had remarked on it earlier, is that everybody throughout their life is going to have some type of a challenge, is going to feel scared, is going to have anxiety, is going to go through periods of being depressed, some more than others. And there are many other types of mental illness which are much more severe. But the bottom line is that this is a normal part of the human condition. And actually, some of the symptoms that we experience are in fact critical to our survival as individuals and even as a species. So recognize that these are normal things, talking about them, and I love to hear about how your kids are kind of helping you understand that these don't have to be mysterious or scary conversations, but they ought to be a part of our normal dialogue. Just like when you break your arm, you know, or you have a cough, you know, or a strep throat. These are things that are okay. They're things that people suffer very, very commonly. In general, they resolve. If they don't resolve, that's when you reach out for help, which you would also with a physical injury that didn't go away, that became more and more challenging or interfered with normal function. So my recommendation to you is talk to your kids about it, and I would even say learn from them about the fact that it's okay, it's normal, and it's really, really healthy to recognize feelings, even feelings that are uncomfortable.
Thank you so much, Dr. Sharon. Our next question goes to Dr. Duarto. Dr. Duarto, the question is, how will parents be held accountable for making sure that they don't send their sick kids to school? Many times before COVID, parents would send sick kids to school or not pick the kids up if they were called to do so at a school site.
Well, you know, as I said, we've been planning about coming back to school for a long time. And really schools, as part of their COVID opening plans, are to make sure that they have practices in place to screen for illness or signs of COVID. So when you'll see when you come back, or if you've already been to your school, you'll see that many of our schools are doing temperature checks, are having students fill out questionnaires that indicate if they have any symptoms. If there is a student that's symptomatic, they have plans to isolate that student. They have rooms, specialized places where a student will wait until their parent comes to pick them up. And I and Dr. Ferrer and her team have gone out to schools and have done site visits and checked to make sure that they have all of these things in place. Because we want to make sure that, one, we're communicating how important it is that if a child is sick, that parent should send them home. But if for some situation, perhaps the parent didn't realize it, and a child does come to school, even if it's with the sniffles and coughing or a mild fever, that there will be screening to capture that student will be isolated, and that parent will be asked to pick the student up. So it's really important that parents know it's not okay to send your child to school, and probably a really good idea to check every day to just make sure that they don't have any type of symptom, because they will be sent home.
Great, thank you for that, Dr. Duarto. Our next question is for Dr. Gilchick. Dr. Gilchick, why have there been no specific guidelines released for allowing performing arts to return to indoor performance?
Thank you for that. Well, this seems to be an extension of the previous question. I think the best answer I have is that they are under development, so they actually will be available shortly. You know, we always want to be properly aligned with state guidelines, so sometimes we wait to see what the state is going to release, but we actually are working on that performing arts guidance now. So that's the one I was referring to previously that would apply to band and other instrumental music, choir, drama, dramatic arts, drill team, etc. So, you know, they're on the way very soon.
Great, thank you so
I know
much.
what I'm doing this weekend. So,
thank you, Dr. Gilchick, for your commitment to that. Appreciate that. A good question for Dr. Duarto and/or Dr. Ferrer, which is, why can't we continue with 100% online schooling until almost everyone is completely vaccinated, so that we can be safe and feel secure and confident? We only have 2 months left.
Do you want to?
I guess I'll go ahead and start. You know, we know that children are really exhibiting a lot of challenges with being separated from their teachers, from their peers. We know that as good as distance learning can be, it never replaces that that intimate relationship between a teacher and their student and the learning that takes place there. We know that some students are really challenged with being isolated and they need to have that stimulation and to be around their peers and to feel again that sense of normalcy, of getting back to their routines. And we also know that from many schools have remained open and have been open, and that schools are safe places. There's been very little spread of the virus, especially from students to teachers, for students to students. So we know that schools are safe places, and if we follow all of the health orders in terms of ensuring that children are wearing masks, and that teachers are wearing masks, and that we have good ventilation, and there's plenty of hand washing and plenty of disinfecting of rooms, and following all of the other safety measures, then we know it's okay. But it's important to know that for anyone who still doesn't feel comfortable, who may have some circumstance in their life where they have someone very much at risk living in their household, those families will still have the option to remain in distance learning. So we want to make sure that parents have a choice. If you're comfortable sending your child to school and you trust that everything is in place and you've researched the science and you want to send your child to school, that's a wonderful option. And if there is a family that feels like this is not right for them, then they also have the option to remain at home. So I'll see if Dr. Ferrer has anything she'd like to add.
You know, having vaccines this early in the pandemic, you know, in terms of time, is really a gift. And it was not something that we all could have anticipated. In general, vaccines take a very long time to prepare, to study, to get through clinical trials. And there was a huge effort made in this country to really change the process for developing vaccines. So we'd be here now with this option of having really 3 excellent vaccines that are available to vaccinate folks. I want to just note that the public health tools that we used for many months before we had vaccine are still very powerful levels of protection. In situations where people are staying fully masked, where they're keeping their distance, where there's good infection control, we have at work sites, at school sites, and at family and community sites seen very little spread. It's just hard to do that and to have a lot of fidelity to it. And that's why I think in some places it hasn't been as successful as it could be, because everyone wasn't doing it. You know, we go into a lot of work sites where, you know, on the floor at a factory, everything looks good. And then you go into the break rooms and there's no distancing, people don't have their masks on, and there's a lot of transmission. So I want to be really strong about the language that we're using that says we have good tools at our schools, even though our children are not going to be vaccinated for many months to come. I mean, we're just starting to do clinical trials with younger children, and so it will take a while. I would anticipate till the fall, where we're going to have some vaccines available for perhaps, you know, 6 to 11-year-olds or 12 to, I mean, I'm really 11-year-olds to 16-year-olds, and then we'll start dropping down. So I want people to feel reassured that in the absence of everybody getting vaccinated, we still have a lot of good tools that we're using at our schools. But I also want to acknowledge that what Dr. Duarto said is absolutely correct. If you do not feel comfortable sending your children to school, please don't. This was never meant to be a requirement, and it was never meant to make anybody feel bad. I think a lot depends on what your experiences have been with this virus to date. Some families have barely been touched by the virus, and other families have seen lives wrecked. They've witnessed people they love die, and they've also witnessed people they love get very sick. And that changes your perspective on how much risk you want to tolerate until we really get closer to the end of the pandemic. And no one should feel judged or judge others because of these individual choices. It's really important to understand that everybody does the same thing you're doing. What's the risk of engaging in this activity versus the benefit? And everyone has the right to make separate decisions for that. And we're in a really good place in this county because people are going to have two good options. If you want your child to go back to school, that's going to be done with as much safety as possible. And if you're not ready for that, you're still going to have the option of high quality, distance learning for your child. And I think this is a place we should all feel good about being, and we should take a lot of pride in being able to offer both of those options to our families and to our students.
Arturo, it's John. I just want to make a quick comment because I think this is a really important point, and the question is a really great question. As I had said in my opening comments, one of the keys to mental health is the restoration of choice, the restoration of a sense of control. By allowing families, parents, kids, the household to make decisions, people are going to feel better. This is good for the collective mental health to have choices, and we haven't had that. In fact, the Board of Supervisors, the 5 people who are all of our bosses, asked me a couple of weeks ago to comment on this exact issue. And I think what we're doing around schools is really, really something that's important. And to the point where families may say, well, let's try it. Let's see how it goes. Let's see what it looks like. So let's see how the kids feel when they go back. Again, doing things at your own pace, making your own decisions. These are really empowering opportunities for us after really kind of getting pushed around by this virus for the past year. So I just want to make that comment. I see this as a real opportunity to improve the collective mental health, to have choices about whether we do distance learning, whether we do in-person learning, or whether we do a hybrid, and the opportunity to tailor it depending on the circumstances and the experiences of individual people.
Thank you so much for that. I think it's important, the issue of choice and having control. I almost think that for some parents, that's a weight lifted off their shoulders, knowing that they have those options. And again, this is something that I think with the ambassador program, parents will come together and have discussions around, here's my concerns. What are you thinking, and what do you suggest, and who can we talk to? So it's just a great resource. So people understand they're not out there by themselves, that we are a community and we talk to each other. And talking to your neighbors sometimes is as helpful as talking to the teacher. And they have some great advice as well. Next question along these same lines, Dr. Ferrer, goes to you, and that is, if children in this county haven't returned to in-person instruction, or a lot of them, I should say, how was data gathered to say that children don't get as sick as adults do?
Yeah, it's a great question, and obviously, all across the country, we have lots of scientists and researchers and public health people that have been collecting information from day one of the pandemic, and most of us are getting infected in our communities and at our workplaces, and then we're bringing it home to our families. And we don't have, because you're right, we don't have the same rich history that we have around what's going on at workplaces with adults with children, because a lot of children haven't been at school. We have learned a lot about children who have been infected in a family situation or a community situation, and we've learned a lot from other countries where children have been in school for longer periods of time, and even in other states where children have been in school for longer periods of time. And I don't think there's anybody that's arguing that there's a preponderance, a lot of evidence that children do get infected. So the first thing is, I still get people who tell me children don't get infected. I mean, you can just look at our data, about 10% of our cases are among children under the age of 18. So children do get infected. They've been getting infected from day one, and children are also capable of transmitting infection. It doesn't look like they get infected at the same rate as adults, and it certainly doesn't look like, particularly for younger children, 10 and under, that they're infecting people as easily as adults are infecting people. But this is a new virus. We are constantly learning new information. The one thing that I can say with all certainty is that masking appropriately over the nose, the mouth, double layered at least, infection control, washing hands frequently, cleaning frequently touched surfaces, and distancing, we do know that those all work. And they protect all of us. So I think the combination of information that we've learned about children and trying to keep children safe in all settings is really important. I also want to point to the fact that one place that children have consistently remained throughout the pandemic is at daycare centers. So many, millions of children in this country have been in daycare from day one of the pandemic. All of the children for many essential workers that couldn't find somebody to care for a child in their home have continued to send their children, small children, to daycare. And so we have a lot of information about infection rates in daycare settings, another setting where children are together. And we have a lot of information about what I call extended day programs for school-age children who needed a safe place to be while their parents worked. And all of that contributes to this really what I say, a lot of evidence of how easily children get infected and how easily they transmit.
Thank you for that, Dr. Ferrer. We had promised we were going to go to the live chat to get some live questions, and we got them. So we're going to transition into the chat box, and I have a great question here for either Dr. Ferrer and or Dr. Gilcheck, which is, how do we know that cases are really down? Is it because there's less testing in LA County?
Yeah, it's a great question, and I'll go ahead and start with the answer. The way we know, the way we really know that cases are going down is we look at both what we call the case rate, and it's not just a pure number, it's how many cases we have per, in this case, we use 100,000 people, so that, it really matters how many people you have, and we look at that, and so we call it a rate. But we also, very importantly, look at something that we call the test positivity percent. So that is, of everyone who gets tested, what percent of those tests come back positive? Because you're absolutely right. If you do less testing, you might find less cases. If you do more testing, you're going to find more cases. But if when you test 100 people, as we did, let's pretend we were testing groups of 100 people in January, and the test positivity rate was in every group of 100 people, 20 people were testing positive in January, and now we also have 100 people testing in March, and really our test positivity rate today is under 2 people are testing positive. So that lets us know that even if you have less testing going on now, and I'll come back to why we could have less testing, that test positivity rate really says there's a lot less transmission going on. A lot less people are in fact testing positive because there is just less community transmission. And one of the reasons why there's less testing is there are less people who are sick and there are less people that are exposing themselves. So more people taking precautions, or we would have more cases, and less people because of that getting sick. A lot of people who go and get tested are people who are getting tested because they have symptoms or they've had an exposure. And we just have a lot less of that. We have a lot less illness and we have a lot less people getting exposed because people are really taking seriously their obligations to protect each other. So yes, we definitely know we have less community transmission now, even if we have less testing. And when I say less testing, we still average probably at least 30,000 people get tested every day in LA County. When in the height of December and January, when we had so many cases, we were what we're calling our surge. That number got up as high as 80,000 people were testing. But again, it's this test positivity rate that you also want to look at, and that is way down right now.
Thank you, Dr. Ferrer. We have a great question for Dr. Gilcheck. which is how will my child be able to eat lunch at school and not be exposed to germs from everyone else that is eating lunch, maybe in the same area?
Yeah, that is a good question. So we increase the safety during meal times by, number one, increasing distance. That's number one recommendation. So that 3 feet of distance, which research has shown to be safe in the classroom, requires 100% masking, absolutely, at all times. So when we eat and drink, we don't wear a mask, obviously. So really, that means that the mealtime should include an increase in distance again, back toward the 6 feet recommendation. In addition, there can be set up for other sort of barriers between seating and between students or people who are eating, in order to also create more protection and block respiratory droplets that might be released when folks are eating and drinking or speaking to each other during mealtime. And again, we're going to suggest or strongly recommend that students remain in the same stable groups that they're in during class time when they do go to have their mealtime, so that again there's limited mixing between the students who are already exposed to each other during the course of the day and other groups. So that's generally how we would increase safety during the meals and during dining.
Great. Thank you for that. I wanted to go on to the next question we have, which is, and any one of you can answer this one, is how is exercise used to help children's mood? Is that going to be a part of school when we reopen? Will they be engaged in activities that will help them with perhaps their mental health or the way they're feeling?
Well, maybe I can just kick it off. There's an abundance of data and really wonderful studies demonstrating how important physical activity is to mood, and to mental functioning, to cognition, and to the ability to even absorb information. So my recommendation to Dr. Eduardo and to all of the schools is to really make sure that there are opportunities for exercise. I mentioned in my opening remarks that it's important for people to get exercise, and that's something that you can do individually as a family. And I would love to think at school, which is such an important platform for our communities, that exercise would be encouraged. And really, I would just say we have to think hard about creating an environment where learning can occur. Force feeding lessons right now is not the best approach, in my opinion, as a mental health professional. We have to look after overall well-being and make sure that kids are receptive to learning, which means feeling safe and feeling secure, and and having the cognitive and the emotional wherewithal to benefit from information.
Yeah, and I would just add that schools are planning to have students engaged in physical activity. Just as Dr. Sharon said, we want to have students in environments where they're able to learn. And students sitting in a classroom, for hours at a time without having the opportunity to get some physical activity, to play with their friends, and we can do that safely. And I think that's the key, is we can still exercise, we can still have kids have a lot of fun at school and do it in a way that's safe.
Thank you for that. A quick question for Dr. Gilchek. How are we addressing the ventilation issue? My school requires windows to be closed when the ventilation system is on. Will this perform enough air change? What is the safe benchmark for air change? And could we mitigate by parents buying maybe a HEPA air filter purifier? How can we improve things?
Yeah, there's a number of measures that can be taken to improve ventilation, which is absolutely one of the very important mitigation strategies that needs to be attended to. Or so first, yes, if you know just opening windows, doors, letting fresh air in is maybe the best strategy, but understood. Yeah, a lot of the buildings will not necessarily allow that. So we're going to so that relies on the mechanical ventilation, like the HVAC systems. You know, both the state and we, the county, recommend that before schools open, they do have a good inspection of their mechanical ventilation system done by, properly trained engineers who may work for the district or may need to be brought in from outside. But it's really important to have someone who really knows the who knows the equipment and knows the standards to take a look and make sure. There are some really excellent standards for both for office buildings and for schools and for other settings that have been published by an organization or association called ASHRAE, which is the American Society of Refrigeration, Heating Engineers and Air Conditioning Engineers. So those are the folks those are the experts. They've written really extensive guidelines. We refer to them, the state guidance refers to them. So that's the first place to start, to look at those standards, to get a proper evaluation of your existing systems. Some of the ways they can be upgraded is to replace and improve the efficiency of filters. There's a metric called the MERV metric. Number goes from 1 to 20 in terms of how efficient the filters are about removing small or microscopic particles out of the air. The recommendation is to have at least a filter with a MERV 13 rating, if or higher if the HVAC system can support that. Obviously improving air exchange, outdoor air exchange. You want to stop using recirculating air, and you want to maximize 100% if possible outdoor air. In terms of air, how fast or how often the air should be turned over in a room. The air change per hour. The general recommendation is a minimum of 4 times per hour, which means that the air is changing every 15 minutes, basically. Again, if the system can do even more, 5 or 6 times per hour, meaning the air is changing like every 10 minutes, even better. But 4 is a reasonable standard. And I think the questioner mentioned this. It's also perfectly appropriate to improve the efficiency in the room to have portable air purifiers or air cleaners with HEPA filters. That's also a recommendation that can increase or accelerate the turnover of the air changes in the room. So again, we know now, this is something we, again, have learned a lot about over the preceding months, how important the quality of the indoor air ventilation is. And there's a number of different standards that we can follow in order to increase safety. Last but not least, let's not forget that great air exchange and ventilation happens outdoors. In fact, it's infinite. So schools can consider increasing more of their activities outdoors to the extent possible. We don't think necessarily that they're going to be able to do 100% outdoor school. That's not required, but to the extent that you can improve, maybe having meals outdoors, some classroom time outdoors. It does require perhaps some creativity, a little thinking outside the box, but always more outdoors is healthier in many ways, but but certainly in terms of decreasing the risk of viral transmission, outdoors is better.
Thank you for that, Dr. Gilchick. Our next question goes to Dr. Duarto. Dr. Eduardo, the parent asks, I'm wondering what support will be available to parents in regards to childcare. Schools are opening up, but not full time, and there doesn't seem to be as many after-school programs that they thought. What do you recommend?
Yeah, it has been really challenging for parents, especially working parents who have to make sure that, you know, they have someone there to take care of their child. A lot of our districts are receiving additional funding to be able to provide extended learning, after school activities, childcare. So I think each parent needs to speak to their district and ask them about the types of supports that they're offering. There are many that we have recommended, and districts are doing their best to try to get that in place prior to school opening. But I know that it's really hard as a parent myself. I know how difficult it can be, but I think that you should definitely check with your district and find out what type of aftercare they're able to offer. We've also been working with other departments such as our libraries, parks and recreation to enter into partnerships so that those are additional options if your school is not able to provide an after-school program. Please be sure to check with your local library and parks and recreations, because we're all coming together to try to provide additional support.
Thank you, Dr. Duarto. Quick question for Dr. Sharon. Dr. Sharon, you mentioned the DMH helpline, the 1-800-854-7771. Yeah, I'm reading it right there. The clinicians that you have there, are they bilingual? Is an issue of English, not knowing English, is that going to hinder me getting through?
No, we have multilingual folks available on the helpline, and we're committed to that. And if there's an issue at one point in time, we certainly would make sure that we would find someone that could communicate, you know, in a linguistically appropriate way. So, and if that doesn't happen, let me know.
You got it. Thank you so much. I'm sure parents will be feeling good about making that call, knowing someone will be able to respond to them in a language that they can understand. Thank you. Dr. Ferrer, a question for you. Has the stable group size increased beyond 14? I'm hearing that they can mix into 3 stable groups. Is that true?
Yeah, I will start, and then I'll ask Dr. Gilchick to make sure that I've got this accurate, because this has been a little bit of a moving target. So let's just start with talking about stable groups at schools. So at schools, there's no upper bound to stable groups, as long as you can keep 3 feet of distance between each of the student desks and 6 feet of distance between the teachers and each other teachers and the teachers and the student desks. So that's really the constraint. So depending on the class size, depends on what your stable group is going to look like. That's really true for elementary school, for TK through grade 5, where we call a stable group your classroom. And you are really asked to, and this was a good question that was noted, you're asked to stay with that stable group for the entirety of the time you're in that school setting. Students in particular should just belong to one stable group during the school day. Now, that may mean that for your child in elementary school that they're in one group during the school day, but after school they go to an after school program, and hopefully that should be another stable group, but it will be a different group. And I'll talk about the requirements for that group in a second. But for the school groups, it's for students, it's really one group. The folks that have some flexibility are the teachers. So teachers can actually be part of 3 stable groups, and you could see why that's necessary. If you've got split days, if you've got teachers that have special certifications, you're going to need them to work with more than one group. The good news is many of the teachers and the staff are fully vaccinated, and that should reduce the risk, the little bit of risk that there might be moving into more than one classroom setting. One of the reasons why we do stable groups is to really make sure that was there to be a case in a classroom, of which, you know, that is going to happen, that there will probably be some cases in some classrooms. You want to have as little exposure to other people as possible. So if you keep those students in a stable group, they have less exposure, and that means that there's less students and teachers that will need to quarantine. But the most important thing is there'll be less transmission throughout your school building. It's a little bit different when you get to 6th grade through 12th grade. The stable group size increases, obviously, because of the way the schedules run. We always recommend keep as small a stable group as possible. I think the upper limit for stable groups in middle schools and high schools is, correct me if I'm wrong, Rob, 120 students. And, that again, really translates to them, again, being able to be in 3 or 4 classes during the day period. The size of, again, what goes on in a classroom is dependent, how many students can be there is dependent on that 3-foot requirement between the desks for students and the 6-foot requirement for teachers. It is a little bit complicated, but the whole notion here is to try to have as little mixing as you can so that if there are cases, there's not widespread transmission in a school community. The more people intermix with other people, the more transmission is likely. And we still have some community transmission, and we have to be honest about that. And that's one of the reasons why we want community transmission rates to stay really low. Most of the cases that have happened in schools have been related to outside of school activities, not to inside of school activities. We've had very little transmission in a school setting. So we have a lot of cases, one case here, one case there. They're not linked to any transmission in the school. They're just people who have tested positive. But because of the way we're so careful at schools, there's very little opportunity, particularly in the elementary schools that have been open. There's been very little opportunity for transmission in the school community. So stable groups are key. And that was a great question.
Thank you very much. Next question goes to Dr. Sharon. Dr. Sharon, the parent writes, I definitely noticed a change in my son after doing virtual learning for so long. He's quieter around the house. I think he misses his friends, but I'm worried about him seeing so many people, and I don't want to send him back just yet. I tried talking to him about what he's feeling, but he doesn't really say much. What do you recommend that I do?
I was on mute. What I would wonder is, how significant are those changes in terms of, let's say, him being more withdrawn, and why is it that he is that he's more quiet? If he doesn't really want to speak, and there's concerns about his functioning, and maybe there are other signs like doesn't have his normal appetite or isn't sleeping well or has other complaints, I would suggest that that would be a good time to reach out to a pediatrician and talk it through. Maybe have a visit, maybe a virtual visit. That's always a good starting place. I also would suggest that you call the helpline and speak directly with somebody where you can describe what's going on in more detail than the question that was just presented to me. But without being alarmist, I would suggest that, like I've been saying here, reach out, connect, talk, and, getting help is something that we should expect, frankly, for a significant portion of our population. And I wouldn't feel bad about that. I wouldn't have your child feel in any way that it's a problem, but in fact that it's a normal response, and one that, just like a headache or some other thing, it's worth checking it out.
Thank you for that. Question for Dr. Ferrer. Will we need to get a vaccine every year now with COVID?
It's a good question, and unfortunately we don't have a definitive answer. What we do know is that we've got a very powerful vaccine that's working very well at the moment. Our set of vaccines, all 3 of the vaccines that are available, are highly effective at preventing serious illness and death. We'll have to wait because, again, these are relatively new vaccines to see how long that protection lasts. And as with all viruses, we've got this issue of viruses mutate. So the way I like to help myself think about it is this could end up being very much like influenza. We've got a powerful tool in the vaccine that helps us prevent serious illness and death, but we may need to have a different cocktail every year, or we may just need a booster every couple of years to really remind our immune system how to respond should they see COVID-19. But you all know we talk about the variants. The variants are really another word for mutations. Some of those variants are of concern because it turns out they could be more infectious than the original strain of the virus that was circulating. So far, all of our vaccines are very effective, again, even on the variants, as far as we can tell. And again, as time goes on, we've got thousands of researchers around the world, both in labs and in real world situations, just checking all the time on how to make sure we've got a vaccine that's effective, as effective as possible. And they've done a really good job to date. So I have a lot of confidence that if we end up needing boosters, it'll be similar to what we all do around flu season, which is we tell you, you got 3 months from September to November to please go in, get your flu vaccine so that you can be protected for the season. And this might end up being something very similar. Right now, the big task in front of us is we've got millions and millions of people here in LA County that we need to get vaccinated. When it's your turn, we urge you to read up on the vaccine, feel comfortable with the information about its safety and its effectiveness, and get yourself an appointment in one of the 550 sites across the county that offer vaccine. We've got the most extensive network in the entire country here in LA County, so we're trying to make it as easy as possible for people to get vaccinated. And at the point that we're going to need boosters, I think it'll look a lot like it does for all your other immunizations. You'll be able to go to your primary care doctor and you'll be able to get that immunization.
Great, thank you for that. We are down to our last question. And then after the question, I'd like to have the three of you give your closing remarks if you can. This last question goes to Dr. Duarto and Dr. Ferrer. When do you see school being allowed to operate as normal? At what point are we okay without masks?
I mean, I'll start with the sort of without masks question. So one of the reasons we're still all telling everyone you've got to wear your mask, even if you're vaccinated, is because we really don't know yet definitively whether the vaccine prevents you from being able to spread disease, even if you never get sick. So if you get infected, we know lots of people got infected, they never had any symptoms, but they were capable of spreading. This vaccine, good evidence, not just in clinical trials, but actually in the real world now, that if you get vaccinated, you got a lot of protection against getting seriously ill, ending up in the hospital and passing away, like super protection. What we don't know is, can you still get infected and pass it on to somebody else? We do have evidence that some people who are fully vaccinated still get infected. They don't have any symptoms or they have mild symptoms, but when we test them, they end up with a positive test, very few people, but that means they can get infected. What we don't know yet is, are they capable of passing that infection on to others? A lot of evidence suggests that they're not spreaders, but we're going to wait and see when that's definitive. And until then, even if you're vaccinated, you're going to have to keep wearing your mask to protect everybody else because we have a lot of people who aren't vaccinated. When we get more evidence about how protected people are who are vaccinated, and we get 70, 75, 80% of the population vaccinated, I think you're going to see us being able to be less restrictive in general and more willing to have situations where people don't need to be fully masked. But for now, I'm going to say, for the next few months, we're going to continue to wear those masks, and they're offering us some of our best protection. So please keep your masks on, and make sure you're using them appropriately. I don't know, Dr. Eduardo, I'd love to hear your thoughts as well.
At schools, we follow the guidance from the Department of Public Health. So as long as the Department of Public Health tells us that we need to wear masks, then we will wear masks. They are the experts when it comes to preventing the spread of this. So we will abide by the rules.
Thank you.
Thank you for that. And I know that schools are a place where these rules are followed, I think, to a T. And we meet with Dr. Ferrer and her team on a regular basis as superintendents, as school principals, on the telebriefing. So everybody's well informed and the questions are very specific. But the reason they are that way is because schools want to make sure that they're keeping everyone safe. The students, the community, the staff members that are there. So thank you for that. So we're going to go to final thoughts, and we're going to begin with Dr. Sharon. Final thoughts.
Yeah, I mean, final thoughts for me really are that spring is coming, and that we have to be really thoughtful and calm and intentional about how we as individuals, households, neighborhoods, communities, the county move forward, but that we recognize how much we've been through, how much we've learned, and that we can really move forward in a way that maybe we couldn't in the past. I think there are things about the stressors that we've been through, not only in the virus, the biological agent, that are bringing us together and have brought us together more than in the past. And to me, that is the memo from the universe with all of these things that are going on. And then on that note, there are silver linings. I mean, there's so many silver linings in the healthcare industry that I don't want to get into it. That's not the topic for the day. But we're not letting go of them. We are gonna hold on to them. We are gonna bring them with us as we go forward. So when we embrace the things that we always have enjoyed about normal life outside of the pandemic, we're going to be doing it with a whole other set of opportunities for great things. And I focus on that as a man, as a father, as a psychiatrist, and I suggest that people think about that. And it's not I don't think it's unnecessarily idealistic, but I think it's healthy, and that together, if we do that collectively, we're going to find ourselves in a really, really great place, going forward.
Thank you so much, Dr. Sharon. Next up, we'll have Dr. Deborah Duarto. Final thoughts, Dr. Duarto.
Thank you. I just want to remind everyone that it has been a tough year, and that we've grown a lot and we've learned a lot, and we've done a lot of planning and preparation to bring students back as safely as possible. And I think that when we come back, we will continue to learn. We will continue to take what we've learned from this pandemic, as Dr. Sharon said, and the silver linings and the use of technology to accelerate learning. But I think that we should all communicate, stay calm, talk to your children, let them know what to expect when they do return to school, and know that we're all doing our best and that safety is absolutely our top priority. Thank you.
Thank you. And last but not least, Dr. Ferrer, final thoughts?
Yeah, no, I mean, I think for me, it's a big thank you to everyone. If anything we've learned from this pandemic is, how connected we are with each other, and in those connections, that's actually where we've gotten our safety. That's where we've gotten our strength. That's where we've learned, really how to get through a pandemic. And I think, it's that very same humility that's going to carry us forward over the next few months. This ability to understand that, our job is really to take care of each other. When we reopen our schools, we're all part of this. Every single person who lives in this county has an interest in making sure that our children, and there are children, there is a collective good here for us to take care of everyone's children, that our children need to be able to thrive. And then for that, and during a pandemic, means we're going to have to make extra efforts together, supporting our parents and our families, supporting our teachers and our staff at our schools, and most importantly, supporting each other. I always say, go with a little grace when things get hard, because things have been hard. And I don't think it's going to be so easy to again transition back into schools that are going to look different for the next few months, for sure. And you know, we're all going to have to just hang together. And I think that's the way we're going to actually make sure that we get everybody at this point to the end of the pandemic.
Thank you, Dr. Ferrer. I'd also like to thank Dr. Gilchick, of course, Dr. Sharon, Dr. Duarto, and Dr. Ferrer for your time and your knowledge and sharing your best thoughts around this pandemic in keeping us all safe. I remember what Dr. Sharon says to parents is that you are in control, and that's a great thing to have. And together, working with the ambassador programs at the school sites, they can continue this type of conversation and really feel more comfortable about the situation we're in. Parents, thank you for spending your Friday evening with us. We appreciate your time. Please reach out to your schools if you have questions. They're there to help you as well. So again, thank you and be safe. Good night, everyone.
Good night.